The value of newborn screening in helping to rescue the lives of children is accepted in all parts of the world. The success of the newborn screening depends, to a great extent, on the quality of the baby's blood specimen. For the screening tests to give reliable results, it is of critical importance that the specimen is properly collected. In this short video, we demonstrate how to take blood spot specimens from babies. The demonstration is in accordance with the 2007 standard on blood collection on filter paper, published by the Clinical and Laboratory Standards Institute, CLSI. Specimen collection for newborn screening is normally carried out between 48 and 72 hours after birth. However, the same method is appropriate with older babies. For example, should it be necessary to obtain a fresh specimen after some weeks. The blood specimen is taken from the baby's heel. Either foot may be used, but the puncture must be made on the side close to the heel, since puncturing the skin elsewhere may damage the bone. Before sampling, gently warm the baby's heel. This will activate the blood circulation and make sampling easier. The blood spots are collected onto a specimen card. According to the practice for your laboratory, either fill in the baby's details or attach a barcode label to ensure positive identification. Take care not to touch the specimen collection area with your fingers. Wash your hands before proceeding, and from then on, wear gloves throughout the period while you are handling blood. If you are taking specimens from more than one baby, you should wash your hands and take new gloves for each baby. Clean the area for the puncture with an alcohol swab and allow the skin to dry. Make the puncture with a sterile lancet or a heel incision device to a depth not greater than 2 mm. Gently wipe away the first drop with a dry, sterile gauze. Do not squeeze the foot, since this may cause hemolysis and can also contaminate the blood sample with tissue fluids. Allow a drop of blood to form that will be large enough to fill the circle printed on the collection card. Apply only once to each circle. Do not layer. Collect the blood on one side of the card only. Make sure that blood fills the circle completely and saturates the paper right through. In some cases, the use of a clean capillary tube without EDTA and heparin is preferred for transferring the blood spot from heel to filter paper. You will find more information on this in the CLSI standard document. Let the card dry for at least 3 hours on a flat surface in the air at ambient room temperature, 18 to 25 degrees Celsius. Do not stack the cards on top of one another while drying. Do not use heating or sunlight to dry the card. Check that the specimens are completely dry and that all information has been given. Send the specimens to the laboratory for measurement within 24 hours of collection. To some extent, you can check visually that the specimens you have prepared are valid. For comparison, the CLSI standard document provides several pictures of unacceptable specimens. The most common pitfalls in specimen collection include inadequate drying of the specimen, inadequate drying of the alcohol used to clean the puncture site, milking or squeezing of the heel such that tissue fluids contaminate the sample, or contamination with other substances such as hand lotion or powder. If you follow the steps described in this video, the dried blood spot specimens you send to the laboratory will almost always be valid. To summarize, the blood should be evenly applied and cover all printed circles. The specimen should be completely dry, and contaminating foreign substances should not be present on the filter paper.